very much to be able to stay until the end of this session. I'm the only one who will give you bad news about this talk, and fortunately those bad news can be counterbalanced by some good news. I'm going to talk of pollution and cardiovascular diseases, and this... Vous n'entendez pas? They don't hear me. I'm going to talk of pollution and cardiovascular diseases, and this pertains mostly to the creation of an anatomic lesion which is already prevalent all over the world, and based on the thing that we cannot see here because it's hidden behind the video, but there are several factors that can lead to atherosclerosis. What is atherosclerosis? It is, everybody knows without having a very clear definition of it. Atherosclerosis is the appearance in the wall of the arteries. Remember, we have two types of vessels, arteries and veins. Arteries is where there's a big pressure that comes from the left ventricle in the aorta and all the arteries of the heart. In the wall of the arteries, there can be deposit of cholesterol and some cells, and both creates this kind of mixture that develops at the expense of the inner lumen of the artery. It grows and grows and grows. It grows sometimes so much that it can obstruct the artery. It can also obstruct the artery when this lesion, which we call a plaque, an atherosclerotic plaque, ruptures. When it ruptures, there is immediately appearance of a clot formation that also obstructs the artery. This is the main source of major events that you've heard of, like myocardial infarction, when it happens in the arteries of the heart, which we call the coronary arteries. It stops the flow for the muscle at a certain area, and this area is called a myocardial infarction. This is very dangerous, very dangerous. It kills in a good amount of time, depending on the surface, and it can kill immediately or in a delayed fashion, days, weeks, months later. So it's very dangerous. It can occur also in the arteries of the neck that brings the blood to the brain. They are called the carotid arteries. Carotid is a Greek word, by the way. Comes from karos, yes, carotid. In fact, it's the name of the oldest known disease. Yeah, there is a carotid sinus syndrome. Have you heard of that? Everybody knows? It's very Greek. It's the ancient Greek had understood that when you put some pressure on the carotid artery, you may lose consciousness. And that's a disease, carotid sinus syndrome, but that's the oldest known maneuver that you can see or do. When you push the arteries, the heart slows down. When you push here, the heart slows down a little bit. Well, anyway, that's not part of that talk. So the carotid artery are concerned by the development of atherosclerosis, and when it breaks, the vessel obstructs, then it's the cerebrovascular accident, stroke, very severe, very dangerous. So I'm not talking of small things. I'm talking of a disease. Which one? I don't know where to put it. So that, yeah, but it doesn't say. You said you don't hear me. Can you hear me now? Okay. So this is due to several factors which are already known, like diabetes, obesity, smoking, and so on. And these factors, some are not controllable. For example, if you have your parents who have done both a myocardial infarction, you are at a very high risk yourself to do it. That's genetics. You cannot do anything about it. But there are other factors on the left side of the left list here where you can do something. You can stop smoking if you're a smoker, because smoking is a strong factor for that. You can try to work on the psychological stress also, which is a big provider. So these are the bad news. The good news is that there are several ways of preventing it, and it's shown here. One major one is the, you don't hear me well. Yeah. Can I have the big microphone? So they don't. In the nutrition part, it has strongly been proven that when eating a Mediterranean diet, that goes much better, and that fights against atherosclerosis. So Mediterranean diet, including feta. I'm very proud to say, including feta. But yeah. Physical activity, and so there are several factors. Now I'm going to talk of air pollution. Air pollution is something which is extremely prevalent now, and that can be the source of small particles which are very, very small and that can penetrate the body and go everywhere in the body. So that's called particulate matter, and we artificially classified in two zones: 2.5 micrometer, the most dangerous one because they go the most far in the body, and 10, which are less aggressive. And those particulate matter are a source of alteration in the blood, increasing viscosity, increasing coagulability, so favorizing thrombus formation. Thrombus is a clot when there is already an atherosclerotic plaque. It can act on the vasculature, creating atherosclerosis, modifying the ability of the vessels to dilate and contract, because they always do so, dilate, contract, to control the blood pressure. Plenty of actions, creating high blood pressure. And they can act directly on the heart, creating cardiac arrhythmias. Arrhythmia is heart disorders, heart rhythm disorders of the heart. There are many are not very dangerous, simply unpleasant, but some are extremely dangerous and can kill very rapidly. So these are the effect of air pollution. And there are usually two types of effect with the short 2.5 particulate matter. There are acute effects. It can irritate the skin, irritate the eye, and there are chronic effects, which are the most dangerous, and they concern almost all organs: brains, lung, heart, digestive systems. So this is very dangerous. But the air pollution does not solely concern the particulate matter. Also, some gas are directly toxic for the heart. Nitrogen dioxide is toxic because it increases inflammation, general inflammation, and inflammation is constantly present to create atherosclerosis, and that leads to cardiovascular damage and increased mortality. And the source of nitrogen dioxide is the traffic emission and the fossil fuel combustion. It's also partly combustion in the wood combustion in your house. When you do a fire, a simple fire, there is a little bit of nitrogen dioxide that comes. Ozone is more famous because of the ozone hole in the South Pole, but that's also something which increases oxidative stress and inflammation in the cardiovascular system, with short and long-term effect on the appearance of cardiovascular disease. Ozone comes from a reaction between sunlight and pollutants like nitrogen oxide and other pollutants. Water pollution is has also impact on the heart, and mostly via heavy metals. And that's also known now, and here we cardiologists have a major problem, because we need to advise to eat a lot of fish. But now the fish itself may become dangerous, because if it's loaded with mercury and lead and things like that. So it's got into water pollution. It also sometimes concerns soil pollution with heavy metal that can enter the food chain and impact the cardiovascular system. To give you an example, this is a study which was published some 20 years ago. It's already a known phenomenon. Looking for the prevalence of acute myocardial infarction, that is sudden obstruction of one of the coronary arteries, as a function of the mercury intake. And the mercury intake is easy to calculate because it accumulates into the hair. So, of course, you need to have hair, so that if you don't have hair, it's more difficult to measure. But if you have hair, and most people have hair, you can measure it. Yeah.
And if you don't have hair, where does the mercury go?
Well, no, it's a marker. It goes there anyways, but you simply have difficulties to measure it. There might be other techniques, but in the hair, it's very easy to measure. And so, two populations: those who have a mercury more than 2 micrograms per gram, have a stronger occurrence of acute myocardial infarction than those who have less than 2 micrograms. So that is an artificial barrier, but that's to tell you that the more you have mercury in your body, the more you're prone to have atherosclerosis and myocardial infarction. So that's a very, very big thing, because there's very little you can do about it. Very little. Noise pollution is something which is new, relatively new, or at least less considered or more recently considered, but that's also very important. And it has clearly been established that if your house is close to the highway, right, then you have more risk of heart disease. And that's so it's a good way to look for silence, but it's something in the big cities which is very difficult to avoid. On top of it, it is a source of disrupted sleeping, which is also a risk factor for cardiovascular disease. So this is so prevalent that it has now influenced the government to recommend policy intervention at the population level, and that is very important because it applies. This is the Jeffrey Rose paradigm. Small shifts in the reduction of heart disease occur across the whole patient population consistently lead. Excuse me. Let me read it. Small shift in the risk of cardiovascular disease across a whole population consistently lead to greater reduction in the disease burden than those large shift in high-risk individuals. In other words, if we treat a whole population, including people who are not sick, not patients, you will have a much better results in terms of prevention of the heart disease than if you only treat those who are already affected by the disease, because they will already. That's another way to say that prevention is better than cure. It's not. For the given individual, it's not better, but for the population, it's far better and far more efficacious. So the European Society of Cardiology has implemented a recommendation saying that putting in place measures to reduce air pollution, including particulate matter emission, gaseous pollutant, reduce the use of fossil fluids and carbon dioxide are recommended to reduce cardiovascular disease mortality. This is a scientific society, a cardiology society. All they do, all what they say is based on proven facts, on studies. So when they are to recommend this, you have to follow it, and you have to follow it. The governments have to interest to follow it. And this is these recommendations have two types of sub-classification: the class of recommendation and the level of proof. And the class is 1, which is the highest degree. It is extremely certain that these pollutants affect the heart, and so you better follow these instructions. And now something very new. Everybody speaks of plastics. Plastics is bad. Okay, fine, we know, but we based that on the fact that, for example, it accumulates in the ocean and creates a new continent, and those things, accumulation of plastic is bad. But it is also bad for the body. And that is less known, at least it was suspected, and only recently, that is some weeks ago, in the biggest journal in medicine, which is called the New England Journal of Medicine, the highest, the most considered, the most respected journal, came out studies of occurrence of microplastics and nanoplastics in atheroma plaques in the coronary artery, in the carotid arteries of patients who were operated for that. You can have atherosclerotic plaque in the carotid arteries, and that can lead you to surgery if the plaques start rupturing a little bit, not completely. There's a clot formation, and then clots come to the brain, and you have repeated brain strokes. So you need to be operated. Or if the carotid artery is too much obstructed by the volume of the plaque, you need to operate in order to restore the flux, the flow to the brain. And they've looked at the plaques, they've carefully looked with electron microscopy, and they have found tiny, tiny particles of plastics. Not in everybody, though. And those who had plastics in the electron microscopy had a much higher rate of death and myocardial infarction. So even looking at there, in this area, you can predict what happened in the heart, and that's due to plastics. So plastics is incorporated in the atheroma plaques, atherosclerotic plaque, and that's a marker of risk. Yes?
Are there any indications about their lifestyle?
Education about?
Indications connected to their lifestyle?
To the lifestyle? No, not yet, no. No, that's a paper who brought for the first time the definite proof that having plastic affects your life expectancy and life quality. But it's not a broad, it's not, these expectations have already partially formulated in the recommendation that I have quoted in the slides before. So scientific society, after that, they gather and they produce recommendations which are the results of those kind of studies. So you better, if you want to talk about pollution, why not we start with the simplest pollution, which is smoking. And smoking is a tremendous pollution. In fact, it should be forbidden to give a speech on pollution if you smoke. So I can see you. That's so irrational to smoke and speak of pollution. And so you have to create messages, deliver messages, but you have to make also pay attention to the fact that the message is well understood, because sometimes it's not well understood. You see this one says no smoking, and so it gets out of the smoking but keeps on smoking. Yeah. It's also important to smoke because you not only do bad to stop smoking, bad to yourself, but also to others. And finally, to have a good news is the fact that there is something very simple that everybody can do, and that is good for the heart and not only for the heart. This is singing. Singing has been proven some weeks ago also in the European Heart Journal that it has a strong effect on the quality of the life and the quantity of the life. And that is shown by several things, including the mental effect it has, the joy that it brings, the sociability that it brings, and the physical exercise that is working on exhalation and control of exhalation to create a sound and modulate the sound. So singing is good. This is why I am very happy to tell you that Yukako Hirawori Kusto, who is here, is going to sing for us very soon. Thank you very much.